with Susan Pearce, the Deputy Secretary of New South Wales Health, and Dr. Matthew O'Mara, the Chief Paediatrician here in New South Wales, who will speak to the vaccination program which begins next week for young children across New South Wales. But I want to begin by thanking all our frontline staff, particularly our health staff right across the state, who are making an enormous effort, enormous sacrifices to keep people safe, to help people through either vaccinations, through our booster shot program, but importantly making sure, as we're seeing greater pressure on the health system across the board, that we are keeping people safe in what is a difficult time for our state. I appreciate and understand that many people across New South Wales are feeling anxious and concerned, but we will get through. We've got through the last 2 years and we'll get through this difficult time as well. Every challenge that has come our way, our state has stood tall. We have made the efforts to get our state through this difficult time, and we'll continue to do that as we move through the coming weeks and months ahead. I want to particularly say the key to that success has been the vaccination rate. And even yesterday we saw, which Susan Pearce will speak to, first dose vaccination rates on having one of the highest days ever. So even now, today, as we have a 95% first dose vaccination rate, an incredible rate here across New South Wales, we are still seeing that number increase. And across the board as well, our booster campaign is going incredibly well. Here today, many people coming out to get that booster shot, and that has been incredibly successful in ensuring that we are able to keep our hospital system in a very strong position at a time where we have incredibly high case numbers. We expect those numbers to continue to increase, but the best thing that you can do to keep you and your family safe is to go out and get a booster shot. So that's my encouragement today. We're seeing right across the board, even here in Macquarie Fields, many people just simply being able to receive that booster shot by walking in. The eligibility across the state is around 2.5 million people are currently eligible for a booster shot. We're seeing in our centres 16,500 being conducted in our 40 centres right across New South Wales, and we're also commencing mobile outreach to regional and remote parts of New South Wales to provide that booster shot. We were particularly successful in the vaccination program for those particularly vulnerable communities, our Aboriginal communities in regional and remote New South Wales, and we will continue that work as we go through this booster campaign. And if we take that same approach that we've taken over the last 6 months of the vaccination program, I'm incredibly confident that we will ensure that vulnerable people right across the state are able to receive that booster. Now, obviously, it's slightly different to the vaccination program. You can get your booster shot at your pharmacist, and we're seeing a major increase in pharmacists taking on booster shots, as well as your GP. And once again, simply because you received your vaccination in a GP or in a hub here or in a pharmacist, you don't have to follow the same program that you did last time. Please get that booster shot. There's 2.5 million people across New South Wales who are eligible. I want to make a comment in relation to obviously the significant lines for PCR testing across the state. I appreciate very much the patience that everyone is showing in lining up in those queues. Rest assured, we're doing everything we can to put downward pressure on that system. We have a number of rapid antigen tests arriving as of next week. That will significantly assist, but my clear message today is if you are not required to get a PCR test, please do not line up in that queue, because we need people who are feeling unwell, who are classified close contact, that is, somebody who is a member of a household of somebody who is positive with COVID, or somebody who is advised by New South Wales Health to get that test, to be able to get tested, and their turnaround time to be improved. So I know that many people are showing great patience. It's a difficult time, but we will get through. And once those rapid antigen tests arrive, and I'm very much looking forward to the discussion today with the Prime Minister and other state premiers in relation to the provision of rapid antigen tests. from a New South Wales perspective, we will do whatever we can in working with the Commonwealth Government, whether that's through financial support, distribution, whatever role the state can play. We want to make sure that every single person who needs a rapid antigen test gets one, particularly as we move through this period of time. So I'm going to end by, once again, thanking our frontline workers, thanking everybody across our state for the amazing effort and patience that you are showing. If we can continue to be patient as we move through this period, if we can continue to treat everybody with kindness and respect, particularly those health workers, particularly those people on the front line doing that testing, we will ensure that we get through stronger out the other side. And whilst there is pressure at the moment, every single day, the Health Minister, myself and Susan Pearce are monitoring those ICU numbers, monitoring the hospitalisation numbers, and if we need to make changes, we will. But ultimately, the key to our success in our state, compared to anywhere else in the world, has been that high vaccination rate. We just need to make that last extra effort to go out, like many people here today in Macquarie Fields, to get that booster shot. It's the best way to protect you, your friends and your family. I'm now going to ask Susan Pearce to provide a further update in relation to the vaccine rollout, the booster rollout here in our state, as well as the hospital system situation in New South Wales. And Matthew will then speak as the Chief Paediatrician in relation to next week the rollout for vaccines for young children across the state.
Good morning, everyone. Look, it's great to see lots of people turning out to get their booster shots, and from this week the New South Wales Health vaccination clinics will continue to ramp up right across the state. By the end of January, we're aiming to be back up to around 300,000 vaccines a week, as we did before, pending our workforce, of course. And I'd just like to thank the staff in our vaccination clinics right across the state, as well as our GP and pharmacy colleagues, for the superhuman efforts they've performed all this time to get vaccinations into the arms of our community. Yesterday we did about 16,500 booster doses across our New South Wales health clinics. That's our biggest day so far. We'd like to see those numbers obviously much higher than that, and our system is prepared and ready for that, thanks to the wonderful work of our districts and their leadership teams, as well as the staff. And as the Premier said, just yesterday we saw over 1,000 people come forward for their first dose. So people are still coming forward for that first dose. It's really important. We have the capacity. We urge everyone to get vaccinated as soon as they possibly can and get those boosters now that so many people are eligible. I'd like to also acknowledge the work of our hospital and health system right across New South Wales. The system is under pressure at the moment, and our staff are our absolutely most precious resource. Let's make no mistake, the staff of the health system in New South Wales have worked tirelessly now for 2 years to battle this pandemic. Omicron has brought us a fresh set of challenges. We're needing to revisit all of the plans that we made during the last 2 years. We will continue to do that to support our staff in any way that we can. Our emergency departments are under extraordinary pressure, as is our ambulance service. Our plea to people is, please do not call 000 unless you have an emergency. Please do not fill those lines with inquiries that could be directed elsewhere. Our emergency departments are not the place for a PCR test or a RAT test. They are there to deal with people with life-threatening emergencies who will always be prioritised. And I'd like to thank the staff in both of those settings for the work that they're doing at the moment. Of course, we're focused on hospitalisations and our ICU numbers. And what is bearing out is what was predicted, that Omicron is less severe than previous strains, but the sheer number of cases is obviously resulting in people needing to come to hospital, and that will continue. So we expect for the next several weeks that we will see that pressure. We also expect, though, that once it starts to decline, it will likely decline quite quickly. But we have got some challenging weeks ahead of us. And as I say, everything that can be done to support our staff will be done as we work through this. What we've demonstrated during the course of this pandemic now for 2 years is that our health system is capable of almost anything. But our staff do need our support. They need the support of the community, and that's what we will continue to do. Thank you.
Good morning. Next Monday, the 10th of January, children aged 5 to 11 years of age will be eligible for the Pfizer COVID vaccine. It's a special formulation of the Pfizer vaccine. It's a third of the adult dose, yet that small dose is enough to generate an immune response that's as strong as a full dose in a young adult. It's 2 doses, 8 weeks apart. We know it's safe. It's been tested in thousands of children in clinical trials, and millions of doses of first and second doses have been given in other countries. We know it's effective. It's very effective at preventing kids from developing COVID, at preventing severe disease, and at preventing transmission of COVID from one child to another person. We know there are a few side effects, and these are mostly minor. Many kids complain of a bit of a sore arm for a day or two afterwards. But the headache, muscle aches, fever, chills and nausea that we adults have often felt are really pretty uncommon in children and can get managed with the usual pain-relieving medications. The serious side effects like myocarditis that happen mainly in older teenagers, we haven't seen in young children. So we think it's a very safe, effective and reliable vaccine. Parents may be weighing up the risks and the benefits of giving their young children a vaccine. We know that COVID is generally a mild disease in children. In fact, many children will have no symptoms at all, and a large number will just have mild symptoms of a cough, cold, runny nose and fever that last for up to 5 days. A few children can become very unwell, and data from earlier strains in largely unvaccinated children in New South Wales showed that between 1 or 2 in every 100 children would need to go to hospital, and about 1 in 1,000 would end up in intensive care, and about 1 in 3,000 would develop the serious inflammatory condition PIMS-TS after having COVID. We expect those numbers to be lower with the Omicron strain, but it's still not entirely a benign disease. And while some children are more at risk from a more severe disease, particularly those kids with serious underlying medical problems, who are immunosuppressed, who are very young. About a third of kids who ended up in hospital didn't have any risk factors. So COVID can be a severe disease in a small number of children. So it's worthwhile getting the best protection you can, and that's getting vaccinated. As of today, there are a small number of children in hospital and only a few in intensive care units because of COVID. There are, as yet, no vaccines for children under 5 years of age. These are in development around the world and are being tested to make sure they are safe and effective. So the best way of protecting children under 5 years of age is by having anyone else in the family who can get vaccinated to get vaccinated. While we might be thinking COVID vaccines are a good idea for kids, kids themselves may have a bit of hesitancy and caution about getting a vaccine. There are some great tools that can help people prepare for vaccinating their kids. There's a lovely video helping kids with vaccines developed by Sydney Kids Hospital Network by child life therapists that talk about how to explain it in language that's safe and gentle but also honest, in helping kids prepare about what's going to happen, what are the steps we're going to go through, what's going to happen to me, about using the words that are pitched right for a young child, about giving you enough warning about what's going to happen, but not too much, about not sharing too much of our own feelings and hesitancy about needles and vaccines with them, but make them feel secure, about giving them choices. Do you want it in your left arm or your right arm? Do you want to sit on mum's lap or do you want to sit on the chair by yourself? Do you want a book or a video, or listen to music? And what's going to make it okay for you to have this done? And then you can think of maybe there's a small reward that you can negotiate afterwards to help make this experience as good as it possibly can be, so that whatever happens, the child comes away with a positive experience. There are 2 vaccines 8 weeks apart, so trying to make the first experience as good as it can be to make the second one even easier. So now is the time to book in for your children's vaccine if they're aged between 5 and 11. The health website has got a list of all the GPs, the pharmacies and the vaccine centres. So book in now to get your young children vaccinated. Thank you.
Questions? Premier, do you support the Prime Minister's plan for rapid antigen tests subsidised for those lower pensions? They still have to pay for them. Should they be free?
Well, we've obviously put a substantial order here in New South Wales for rapid antigen tests, and we want to make sure those who need access to a rapid antigen test get access to that. Now, I've had discussions with the Prime Minister, and my understanding is that there will be further discussion in National Cabinet today from our state government's position, and I've spoken to the New South Wales Treasurer this morning. We will put whatever we need in to ensure that that support is there for people right across the state. And if there's a financial agreement that we can reach with the Commonwealth Government, from my perspective, from the Treasurer's perspective, there is no dollar figure that we will not put on the table to ensure, as we move through this next phase, rapid antigen tests are available to anybody right across the state who needs one. Obviously, the Prime Minister has spoken about those in more vulnerable cohorts and concession card holders. We will provide that support, but ultimately, as I raised earlier, in respect of the distribution of tests from a New South Wales Government perspective, for the ones that we are currently procuring, we will have those available at testing centres, and we're working through other areas, schools, healthcare and the like, to make sure those tests are there to support our state as we move through, particularly the next challenging few weeks.
So how will they be handed out? Will they be free?
Well, obviously that's a matter for National Cabinet today from the Commonwealth's perspective. What I certainly want to see from our state's perspective is that those who need a rapid antigen test get one. Clearly, with the significant queues that we're seeing at PCR centres, by the provision of rapid antigen tests at those centres, we will see a substantial alleviation of pressure on testing. So that's something that we're clearly focused on from a New South Wales Government perspective, but also obviously across the board, there's got to be the supply there for pharmacists to be able to sell these products. Ultimately, there should not be any substantial price increases that we're currently seeing. That is concerning, and it's great to see the ACCC come out in relation to that practice. But it's going to be a challenging period. Eddie, the next couple of weeks, a few weeks as we move through this, we need everybody to continue the patience they've demonstrated. As those case numbers increase, vaccination has been key to ensuring we've kept people safe during this period of time, and the faster we can get those rapid antigen tests into the hands of people across the state, we want to see that, and we'll work with the Commonwealth Government on any.
What about schools?
Yep.
When kids go back to school,
Yep.
what planning is there?
Yep.
Are parents going to face those same problems?
Yep.
School being shut, having to teach their kids?
Well, we want a seamless transition back into the school year, and already, as of last week, the Education Minister, the Education Department is working very closely to ensure that as school goes back, that kids can get back into the classrooms as safely as possible. We believe rapid antigen tests will play an important role in that. We're currently working through that with New South Wales Health and Department of Education, but we're incredibly confident we'll get kids back into the classroom day one, term one.
But is there likely to be, on schools concerned, is there likely to be changes to the rules around vax and unvax, particularly within the classroom? Because we're going to see teachers clearly very concerned as schools return.
Well, we'll work through those settings. Our number one priority is to keep our kids safe and to keep our teachers safe as we open up classrooms. Every area across the system, as we move through this period of time, will be under pressure. Obviously, we've made challenging decisions in the past in respect of wearing face masks for teachers in the classroom. My expectation is that will remain as we move through term one of this year. But we will work through those issues with the Department of Education and New South Wales Health. The outcome that we want to see in our state is that we get kids back into the classroom, day one, term one, in a safe way. And particularly, given the rollout of vaccinations for young kids next week, I encourage parents across the state to make those bookings. That's the best way to keep your kids safe. As Dr. O'Mara has said, these centres will be available right across New South Wales to ensure that kids get vaccinated as quickly as possible, and we expect to have as little disruption as possible to the school term. Now, Chris, that doesn't mean I don't expect there to be bumps along the way. We're in a pandemic. There'll be curveballs thrown at us over the course of this period of time, but we've overcome those challenges over the past 2 years. Particularly, we've seen it at points in time towards the end of last year when we got kids back in the classroom, that we had to close schools from time to time. We obviously want to minimise disruption as much as possible as we move through. We're working on those plans now. We're incredibly confident we'll get kids back in the classroom day one.
Premier, every day.
Sorry, say that again.
Well, there are so many businesses right now closed or barely open
Yeah, as I said, there will be challenges, but we will do everything we can to minimise disruption, to have schools open, and that's what we've done last year. It wasn't without its difficulties. We saw that. We saw a number of schools closed, but the alternative is to keep everyone closed. That's not what we're focused on. There's always going to be difficulties that come our way during this pandemic, but we've overcome the majority of them last year. Yes, there was disruption. There's naturally going to be disruption when you are in a pandemic, but we are working incredibly hard behind the scenes to ensure that schools can open on day one, get kids back in the classroom. I can't guarantee that there won't be disruption from time to time based on what comes our way, particularly to the question in relation to isolation requirements at the moment, and as case numbers increase, that will put more and more pressure, not just on the school system, on the health system and businesses right across the state. We are seeing that at the moment, but I'm completely confident as a people we will overcome this challenge. We overcame the challenges of the last 2 years, and once again, as Susan Pearce has pointed out, we do expect to see a sharp escalation, continued escalation in case numbers, but the experience around the world with Omicron is then followed by a sharp decline, and we also know that Omicron is much less severe than the Delta variant and previous variants before it. The other point I would just make once again is just in relation to those cues and in relation to close contacts. I have received substantial feedback that people believe they cannot go to work because they are deemed to be a close contact when they are actually not one. And I know there is confusion because definitions have changed from time to time, most notably the change that occurred at National Cabinet last week, and that's why this is very important. Close contacts are only those who are deemed to be household contacts of a COVID positive person. So unless you fit that category or are advised by New South Wales Health that you are a close contact, you do not need to isolate. You only need to get a test if you have symptoms of COVID-19.
Premier, every day we're getting contacted by nurses who say that they're working in highly understaffed wards, that have more patients than ordinarily. If they call in sick, they know there's going to be no one to replace them. What is the government doing to replace or put extra staff into emergency and essential services, or is it just a matter of waiting it out now at this level?
Well, a couple of things on that. There will be a discussion this afternoon in National Cabinet in relation to the challenges around particularly furloughed health staff. There is no doubt we're seeing substantial pressure on the system, not just in New South Wales, around the country and around the world. And our nurses, our doctors, our paramedics, our allied health professionals, everyone who works in our health system is making an extraordinary effort and sacrifice to help get us through. And it's only natural in a pandemic, the health system is going to be under pressure. But we've got through 2 years, we'll get through this. We're obviously working in relation to how the challenge of furloughed staff can be improved and the isolation requirements for close contacts. New South Wales Health is working on that, and I might have Susan just make some further comments in relation to currently the work that's occurring in New South Wales, but we're obviously working with the Commonwealth as well in relation to broader definitions.
So it's a matter of changing the definition, not getting more staff?
Well, I'll pass to Susan.
Thank you. Look, you'd be aware we've made changes to the close contact arrangements for staff, but I must stress it is only under certain circumstances. That is not the rule across the board. The suggestion that people are being brought back to work when they're positive is certainly, we have no evidence of that. And if you are a close contact and you're a health staff member and there is a critical need for return, there is a process to be gone through. That's really important to understand. But like every other industry, health is impacted by furloughed staff. And we have more than 3,000 staff yesterday who are impacted by furloughing as a consequence of either being a case or a close contact, and we're working through that every day. The other point that I would make is that we've been preparing for workforce surge for 2 years. But Omicron has certainly impacted everything that we're doing, and to some extent over this period it created the perfect storm. Our health teams were looking forward to a well-deserved rest over Christmas. People are encouraged to take leave over this period. So, you know, it's been a really challenging period for the health system to get through this, and we will get through it. But the other really important point I think to make is that whilst we focus a lot on hospitalisations and ICU and ED and ambulance, which is all absolutely necessary, there's a lot of work going on in the community at the moment, and our health teams who are supporting the tens of thousands of cases in the community every day are going unrecognised. We have done our best, our absolute best, to get in front of this by providing information to people who are COVID positive to help them to care safely at home. We know that a lot of people can care safely for themselves at home because our numbers are demonstrating that each and every day. So there is a whole process going on in the background of this to contact people who may be higher risk, to assist them where needed, and we're doing our best to get to all of those people, working with general practice, etc. And all of that's being done to help also to protect our hospital system. So I think it's really important to acknowledge that none of our health system sits in splendid isolation. It's part of a big, connected, networked system. And that also extends to how we network our services, not just across the metropolitan areas, as we were doing yesterday. We had a very busy day yesterday. Let's make no mistake, it was incredibly busy, a lot of pressure on our ambulance service and our emergency departments, and we worked right through the evening to make sure that we were moving our resources around, and that's what we do. That should not be seen as a failure. That is seen as a system that is connected and working, and every single day of the week, 7 days a week, we meet with our chief executives, we talk about where our system pressures are, and as I said at the start, our health staff are our most precious resource.
Can you explain what's happening? It sounds like it might have been yesterday in terms of the 000 number and the people going to emergency departments for the tests. What's going on there?
What we're seeing with 000 calls is, again, not unique to New South Wales. So in Victoria yesterday, same issue. The calls to 000 lines have increased enormously. Now, part of that we think may be people calling back to check on their response, but it is also people seeking health advice from that 000 line. We've got well-published numbers for people to call Health Direct, to call, for example, if they need health advice, go to their general practitioner, etc. 000 is not for general health advice. So that phenomena is being seen here in New South Wales. It's also being seen, interestingly, we were speaking to Canadian colleagues yesterday in their health system, exactly the same thing is occurring there.
How are you going in terms of getting on top of the testing backlog? You know, what's the average time now someone might be waiting for results?
Look, there's still significant issues with the PCR testing. Again, there's no simple way to fix that. As you have been, I think, advised last week by Professor Dwyer, this is a finite resource. And where we could previously, and our private labs could previously pull samples, now they have to do them all individually. It's completely shifted the entire testing regime. It's not a matter of having more testing clinics open, it's a matter of being able to work through those processes, which is why the message is being sent loud and clear. Please come and get a PCR test if you have symptoms. Please come and get a PCR test if you're a close contact, but otherwise please do not do that. And if you are concerned and you need, and if you can access a RAT test, and the Premier's noted, we will have significant improvement in our RAT test availability from next week and toward the end of next week. That is another option for people who may be concerned if they're going to visit vulnerable or elderly relatives, if they've been in a venue where they may not be identified as a close contact but want to check. And I understand that the community is anxious about this. Our messaging needs to change along with what Omicron is bringing us, and that is the hard adjustment for our whole society at the moment. It's the hard adjustment for everyone right around the world.
How will you get one of those? If you have an elderly relative and you want right now standing in the queue, if you can get one of those, how will you get one of those?
The Premier's already mentioned that National Cabinet will meet and discuss that this afternoon, but from our perspective, we have, as the Premier's noted, as a state, procured millions of rat tests that will start arriving from the end of next week in particular in larger numbers. It is our intention to distribute those rat tests to the PCR testing clinics to enable people to access them at that point. The other point to make, though, is that already we've been doing is distributing them to vulnerable groups of people, to homeless, to people in refugee areas, and to Aboriginal medical services as well. So that work will continue to make sure the most vulnerable people in our society will have access to rat tests provided by the state.
What about if you don't drive? What about if you don't drive and clinics are saying, look, advising against walk-ins? What's the arrangements there? People who may have actually tested positive with a rat test, don't drive, can't get the PCR as a result.
Well, look, there are many variations on the theme on these issues, of course. Look, the pragmatic advice that I would give to people is that if you have symptoms, if you have a positive rat test and you are unable to get a PCR test, or if you're waiting for the result of your PCR test, assume you are positive and stay at home for 7 days. That is the pragmatic advice. And that's the advice that is shifting now right across the world, and there'll be further discussions on that, I'm sure, but that would be my advice.
So yeah, you're perfectly right. So there was a range of intervals approved from 3 weeks to 8 weeks. Currently the interval is 8 weeks. I don't have information on the vaccine supply.
If you've got one there, if you've had COVID, you've got antibodies in your system, does that have any impact on how soon you need to get the booster?
Okay, so the general recommendation is if you've had COVID, you can wait up to 6 months, but can get vaccinated as soon as 1 month. What we want you to do is be free from symptoms, from the COVID infection before you get the vaccine.
We saw with the 12 to 15-year-olds a really rapid uptake of kids coming forward to get vaccinated. We would really love to see the same again, obviously, with 5 to 11-year-olds. GPs at this time of the year, obviously, will be gradually reopening post the Christmas break. As the Premier's noted, pharmacies are going to play a very significant role in this rollout, as they've increasingly done toward the end of last year. We still have appointments available in our clinics. Some of them have tightened up into early February, but we would encourage people to have a look. There are plenty of distribution points around and available for people.
Yeah. Well, I think clearly as the pandemic evolves, our response will evolve with it. And we're already seeing the changes of obviously a highly contagious variant that is less severe, and the different challenges that presents to the state. And now with obviously substantial PCR queues, we think that once there is greater access to rapid antigen tests, that those queues will be alleviated. That's why to Eddie and Chris's question, where do we see the main place immediately for the distribution of those tests would be at those PCR testing clinics. So rather than sitting there and having that PCR test, we'll be able to move through faster by getting those rapid antigen tests distributed through that network. Chris is asking further in relation to, well, how will the whole distribution system work? Well, what we need to have happen here is a coordination between the states and the Commonwealth government, because you've got the Commonwealth government purchasing rapid antigen tests, you've got states and territories purchasing tests as well, as long as there's a coordination. And I think the best place to do that is at National Cabinet. And then in further change, I saw Professor Coignon's comments this morning. I see the sense in what he's saying in circumstances where you don't want, you want the most vulnerable people in society who may have more severe reactions to COVID being the ones who are in the queues. But at the same time, we want to make sure we continue the testing. And this is a challenge, and I very much appreciate the patience that everyone is showing, because for the last 2 years, we've had strong communication that please get tested, and everyone has made that effort. But as we move through this next phase, our response needs to change as well. And clearly we've made some change at National Cabinet last week. I think rapid antigen tests will be part of the solution, but if there are other areas of policy change that can be made that will make sense for the system, such as the one that was proposed this morning, we are very happy to look at it.
Premier.
Just on that point of coordination between federal and state government, people aren't seeing that. People I spoke to yesterday, so they feel abandoned right now. They feel they're fighting this on their own. What do you say to that?
Well, I think there is strong work being undertaken at all state government levels and at the Commonwealth.
It isn't filtering through. People feel they're sitting in queues for hours, the businesses are closing because their staff are positive, contact. They can't earn an income, they can't go back to work because their employers says they need a test and they can't get one.
Yeah, and I acknowledge the pain and challenge that people are feeling right across our state. It's not just unique to New South Wales and our country, it's happening all around the world as we move through this next phase of the pandemic. But whilst this period is difficult, there's going to be pressure on every system, not just the health system. I know that particularly smaller businesses will have to close at various points in time. Those smaller businesses with less staff who have to isolate, that's going to be an incredible challenge as we move through. I accept that, but we are a strong people. We have got through the last 2 years. Yes, there are difficulties, and particularly I think what's coming through now with the queues. What I'd say to everyone across the state, we are doing everything we can to alleviate and reduce pressure on that system. The Health Minister and myself every day are looking at ways in which we can ensure that we get through this period as seamlessly as possible. But there is no doubt, whether it's the queues that we're seeing today, whether it's the challenges on the health system and businesses, and when we go back to school later this month, there will be bumps along the way. But we're going to get through it, and we're going to get through it together. What we're seeing is, as we move through with this next variant, we are seeing a highly contagious form of the virus. We are seeing cases increase at high rates, but the positive situation here in New South Wales and around the world, globally, what we are seeing is a much less severe disease. We're seeing a conversion rate here in New South Wales of cases to ICU at about 0.3%. So that does not mean, though, the system is not under pressure. As Susan Pearce has pointed out, we're doing everything we can in relation to those staff that are furloughed, the structures that are currently in place in our hospital system, just like we did, Eddie, with Delta earlier in the year. We made those changes to put downward pressure on the system. But there will be difficulties, but we're in the heart of this at the moment, particularly here in New South Wales. Other states are behind, but will then be in the position that New South Wales is in. We've just got to pull through. I believe we will pull through. We've pulled through every challenge that we've had over the last 2 years, and we'll get through this as well.
I know this is federal, but childcare centres, hundreds are closing. Now schools coming back, right? Childcare centres are closing. People are going back to work.
Yeah. Well, I think so. What was the question?
Well, childcare centres, this is something that needs to be raised at the National Cabinet today, raised at
Oh, definitely. I mean, I'll certainly be raising that challenge that we're seeing both in New South Wales and Victoria today, because as other cases increase in other states, what is occurring in New South Wales and Victoria will be replicated across the board. But whether it's the health system, childcare, schools, there are going to be, as I said, bumps along the way as we move through this period. And as I said, just we've got to be patient. We can control what we can control. Any changes that can be made in relation to close contacts we'll look at. We obviously want to keep, as the case numbers increase, before they decline, we want to keep as much of society open as possible, as many businesses open as possible. And we'll get through it, just like we've got through the last 2 years. Thanks, everyone.